Hi all, this is Dr. Jennifer Coombs and I'm the Executive Director of Essence Health and Research, a 501c3 healthcare nonprofit located here in Sammamish, Washington that serves all around the surrounding communities and also Washington State. And I wanted to do a little bit of a warm welcome to all of you who are kind of finding yourself onto this website and just learning about what this clinic offers and how it can help you, to give you a little bit more of a personal touch, so that way it makes it easier for you to navigate to figure out if Essence Health and Research is the clinic for you. This particular clinic offers metabolic health care. And so that type of health care is for those who are more focused on chronic disease, improving chronic disease, also mental health conditions, and also for general or optimal health. I am a doctor of clinical nutrition, and that is not something that everybody knows what those types of doctors are. It's a DCN. And what this type of doctor is sort of a cross between an RD and a nutritionist and a PCP. I am trained as a clinical doctor in metabolic health care, which means that I can help people from a full range of different types of medical conditions, anything from diabetes to GI conditions to headaches to and menopause to osteoporosis, and the list can go on and on. So if you scroll down onto this website, you'll see a lot of things that I can help patients with. And as my training goes, is that I am considered in this particular state, due to not having a physician's license yet, I'm considered a dietitian and nutritionist. And so I definitely have all of the qualifications of that particular scope of practice. That is the scope of practice in which I see you in this office, but I'm also a trained doctor, which means that I do a lot of assessment just like a normal PCP would, and I really kind of go down and assess people through mental health. I assess people on your medical conditions, your blood labs, medical history. I do nutrition-focused physical exams. There's a lot of different types of assessments that I do, also body composition, vitals, that kind of thing. And I look at and I approach it from what's called a functional medicine or a functional nutrition approach within the scope of practice that I can practice with inside of Washington State. And so basically, whenever you're coming in with any type of diagnosed condition, I cannot diagnose you with the condition, even though I know how to, in anything related to metabolic health. I can't do that in this state. And so I do work really well with integrative healthcare practitioners. I work with the PCPs. I work with specialist doctors as an integrative healthcare team for you. So by the time you come to this office, you are met with someone who can really truly focus on someone who is, if you're wanting to get, say you've got your diagnosis from your PCP or your specialist doctor, and you really truly want to focus on root cause care in the sense of saying you want to get at this not necessarily fully from a pharmaceutical perspective, because I can't actually prescribe drugs. I can support whatever your PCP or your specialist doctors have given you, as far as if you've been prescribed various different types of pharmaceuticals for various conditions. But mostly what this particular clinic will focus on is actually trying to prevent the use of those drugs or to decrease the doses of those particular drugs if you don't want to use them. And it gives you a different type of approach. And mostly because I am a doctor of clinical nutrition, I have the full body and array of different types of therapeutic diets, supplementation, exercise programs, anything from more of a natural perspective that's focused on more of a functional medicine or a functional nutrition approach, which is really root cause care. So it's really trying to take your medical conditions and looking at it from a medical, not such just a medical, but a metabolic perspective. And what do I mean by that? Metabolic health care is really looking at what have I been trained in? And I've been trained in a lot of biochemistry, a lot of genetics, a lot of hormone imbalances, a lot of looking at diseases from a mechanistic or root cause or cause of your condition. So I look at the physiology, I look at the biochemistry, I look at the blood labs, I look at everything that could be going wrong to try to figure out what is the pinpoint of why you don't feel well. And looking at not just a cookie cutter standard of care approach to a particular condition, but what is actually the cause of your condition. And then based on that, that's called a mechanism of disease. That's the cause. Okay, so I've taken all that information that you come in with, and whether it's medical lab, medical history, specialty testing, anything that comes from a lot of your different types of doctors. And I take that all in, I combine it in with the assessments that I do, and then I look at what can I do for you from more of a natural perspective. And it's not just shoving a lot of supplementation at you or a therapeutic diet that's really, like shoving the Mediterranean diet at a lot of people. This is evidence-based care. So that means it's based on research. It's based on really looking at your case and really looking at what's wrong with you. And then taking the time to figure out what's the best avenue of care for you. It could be based on your budget. It could be based on your insurance. It could be based on whatever it is that you want to, what type of readiness that you have, what kind of goals do you have, what kind of time do you have in your life. And so really taking you from whatever you've been diagnosed with or whatever your symptoms are, and assessing you and saying, this is what's going on with you, this is why you're not feeling well, and then creating a program for you that's going to help you get from A to B in getting well. Okay, so it not necessarily getting well does not necessarily mean that it's a one stop or a one answer type of solution. It means that a lot of times getting well means that you have to be able to commit, and you have to be able to assess your readiness and your budget. A lot of times this type of care is going to be covered under insurance because, again, in the state of Washington, I'm considered a dietitian and nutritionist, and is an often underused type of insurance care, insurance benefit that you have that you may not be using. And a lot of times people will have anywhere from 3 to 20 plus visits on their insurance benefits that you may not have to pay anything out of pocket for. And so one of the things I like to do when I relate to people is to try to educate people on how important it is for you to use your dietitian and nutrition benefits on your insurance, because PCPs don't always have all the time to spend with you to solve all the problems. It doesn't mean that they can't solve them. It means that often they don't have the time to. They can't do all the work that I do at the DCN, where I'll spend possibly an hour on your case or more after I see you. Not only do I spend often anywhere from 30 minutes to 90 minutes with you in a visit to try to make sure I'm getting all the answers that I need and doing the assessments and making sure I'm taking in what it is that I need to take in from you, I'm also doing a decent amount of research after I see you to make sure that you have the right type of program and the right type of care that you need that fits in with inside of my scope of practice. Until I'm considered a physician, I can't diagnose you and I can't give you a drug. But I can work integratively with your medical team, and I can also provide for you anything from the therapeutic diet, the supplementation, the exercise program, but I can tailor that into what's really wrong with you based on evidence-based research that is going to get you well. And this particular clinic sees a lot of results because of the approach that I use in my practice. And so I want to encourage you to really consider this particular clinic for your care, and alongside of whatever you need to do with your PCPs or your specialist doctors. And this is how I kind of get people to get started. This is the first of the year. Every time at the first of the year, usually people are starting to schedule your annual physical. And I usually have people start with your annual physical, and that's the best place for you to start as far as making sure that you have the right types of labs, the right type of foundation, the right type of assessments to start off with your new year with your PCP. So I really encourage that relationship with your PCP. If you don't have a good PCP or you feel like you could use a better one, often I won't be able to refer you on to PCPs that I know that are great in various medical systems. And so until I have that PCP status, I can't serve as your PCP. I know I've been asked a couple of times about that. And I can't serve as your PCP right now. I'm hoping to be able to work with legislation in the future to be able to have physician status in this particular state. But until that happens, I'm very integrated with the PCP system and making sure that you have the care that you need, and also being able to encourage you to get the labs that you need run for your annual physical. And just to kind of expand on that, there's actually a page, if you look at, if you scroll across the top, you're going to see basically a couple of different tabs there. And you may want to go into more about EH&R, where you see where it says make your appointment. That's going to give you a sort of a layout as far as what you need to do to make your appointment here. here. It's really pretty easy, but I want to also encourage you, for those of you who are trying to get your annual physical, you may want to come to me first as far as what kind of labs you think you need to be run at your annual physical, because a lot of times we're finding, at least I'm finding, as a doctor and also as a healthcare practitioner, is that your annual physical is not getting you're not getting all the labs that you need to be run. It could be, there's some standard labs that need to be run, but there's also a sort of array of labs that, because it's your one chance per year to get your wellness care visit, which means that you need to have a certain battery of labs run to make sure that you are well. And it's not necessarily based on medical necessity. It's based on you being functional and well. And so you need to make sure that you have that full battery of labs run. And if you look at the make your appointment tab, it's up there. You just kind of go underneath EH&R. It would tell you a number of labs that I typically will have people run for their annual physical. But you may want to reach out to me and just let me know what's going on with you, and you're interested in care and you would like to know what you need to do first. And I'll let you know what type of labs that are more specialized for what your conditions are and what's going on for you. And that way you can make your appointment here, and I can take you whether or not you've had your annual physical or not. Usually I highly recommend that you bring in your most recent labs, most ideally within the last 6 months to a year, so that way I have a base of what's going on with you. And then of course any type of labs or any types of testing or previous diagnoses that you have, especially for this particular clinic, because you're coming in and using medical insurance. And I invite you to go ahead and scroll down to look at the directions for that. The expanding list of insurance-based care that I can do now is always expanding. So many more of you can be served in this particular area, and I look forward to being able to serve you with that. And I just want to make sure that you have everything that you need as far as whenever you come here. Usually you're going to start off with an initial evaluation. An initial evaluation will again entail looking at all the medical history, the labs, and doing a nutrition-focused physical exam, learning more about your story, all the things. And then I go from that particular visit. I typically tell people about my model. This is kind of how I approach things, is that you do your initial eval that can last anywhere from 60 minutes to 90 minutes depending on what your insurance is. And then you typically will come back a week later to get your program and to learn more about your medical condition, to learn more about why I've made choices for you as far as what your program is what I think you need to be doing as far as moving forward to get success on your goals. And then we sit there in that visit and we collaborate. And we start to look at, what do you have time for? Many of you have families. Many of you have a budget. If you have to pay for anything out of pocket, what type of time is going to be involved? What kind of things are you willing to do? What kind of changes are you willing to make? And then I fine tune that program. That second visit is essential. It's usually a week after that first initial evaluation, where we really sit down and we collaborate and finalize that program and how we're going to start with you. And then your program will usually last anywhere from, it could be a month, it could be 3 months, it could be 6 months, it could be, I've seen some patients for over a year or two. And depending on what's going on, the more complex your conditions are, I want to encourage people who have chronic diseases and mental health conditions that your programs may be longer, especially if you've been suffering since maybe birth, or you've been suffering for a couple of years, or you're just trying to revamp your life because you've had bad lifestyle habits or bad eating habits, or whatever it is getting you in the predicament that you're in. To really have faith in yourself that starting is half the battle. And I want to encourage you to start, especially now as we arrive into the new year. We're just really kind of getting into really improving our health. And that kind of brings me into a new, in this new administration, something called Make America Healthy Again. And I know that there's all these politics that are out there, but I want to impress upon you that this is a good idea. This particular movement to put nutrition or clinical nutrition and nutrition education at the forefront of our communities, and at the first line of defense in chronic diseases and also mental health care, and also optimizing our health, is very important. And it's going to change. It's going to change school systems. It's going to change community systems. It's going to change healthcare systems. It's going to insert nutrition almost in every area of our lives to really make changes, to consider our bodies, our mental health, our spiritual health, the physical, everything more important, to make better choices, and that comes from better education. Now, there might be a lot of differences as far as what people think is right and wrong, but I will be doing some work with either podcasts or education out there to help you understand what this particular movement is all about and why is it so important for our healthcare system and our school systems and our community systems to get on board with this as we take our steps forward. It's an exciting time where we can really change what we do first when we get sick, or what we do first as far as the mode of prevention. And I want to encourage us, whether you are very political or not, to really stay on to what's important. And that's really getting well and staying well and being able to be in your purpose, to be able to either provide for your family, to be able to live your life at your fullest, to be able to have a long life, to be able to do what you want to do. And all of this is really designed for that purpose. You don't have to be a political person for that. I'm really an advocate for you to get the best care that you need, to be able to get the root cause care that you need, and to approach this from, there's not enough of us. As far as DCNs are the one doctors who really focus on metabolic health care. And many of my types of patients are anything from diabetes to osteoporosis, to menopause, to GI conditions, to migraine, to headaches. I see everything from children all the way up to the elderly. I take all the insurances that will help you, whether you are low income status to a high income status, whether you are Medicare, Medicaid, or all the insurances in between. And so I want to encourage you this year first to get your annual physical, and reach out to EH&R if you live in the area, if you're in either in the Sammamish area or in the King County area, or even if you're outside this area, you're still in the state of Washington, I can still help you. So feel free to reach out to me. I'm Dr. Jennifer Coombs again. You can reach out to the EH&R clinic at 425-505-3090. You can also reach out to make your appointment at drcoombs@essencehealthandresearch.com. So I encourage you to look at the website for those instructions and scroll down to learn a little bit more information. And consider a donation to Essence Health and Research. This is a 501c3 nonprofit that is always trying to grow and offer more to our community. When we have the funding to do that, all the income that comes into Essence Health and Research is primarily based on income from insurance-based care. That was a big transition that Essence Health and Research had made in the last couple of years to be able to offer insurance-based care. But there's also other types of ways that clinical nutrition and yoga and a lot of these services at Essence Health and Research can help our communities. And whenever you consider this nonprofit as something valuable to your community that can offer, especially with the Make America Healthy Again, that the idea that we can do a lot more for our communities when we are considered valuable. So I can encourage you to consider Essence Health and Research valuable. This clinic also helps to train the next generation of nutritionists or doctors who are going to go out there and do more care for in a functional, either medicine, functional nutrition approach to help more people maybe in their states or in their communities. So everything that you can do to help support this nonprofit is valuable. And I would love to talk with any of you if you would like to support this nonprofit to help get it further into the community, and feel free to reach out to me. But in the meantime, thank you so much for listening to this video, and I hope to see you on the path. So take care of yourself and have a great year.